Hello everybody, welcome back to a new video of mine. So in this video we are going to discuss about all the things you need to get your medical done for your PR. So if you guys are interested in Australian permanent residency, so consider subscribing to my channel because I am going through this process and I'm like uploading stuff regarding all these things in a timely manner. Maybe it will help you out in some way. All right, so I had my medical last week, so it's like fresh. I'm just fresh out of the medical thing, and I thought it will be a great idea to like explain you in detail the step by step everything which happens in the medical facility. So first things first, when you pay the fees for your application, the PR application, this medical section gets opened, and when you click the link it will generate a form for you, and there you'll be able to see your HAP ID, HAP ID. So the very first important thing, the file which you need is this PDF which contains your HAP ID. All right, so get that thing printed out, and then you'll have to like visit the website which provides you with the hospitals which are like situated in your area. So for me, I live in Hyderabad, so it was CMM, Center for Medical Migration. So you can get the list by just doing a Google search, and there is an Australian government website which lists down all the hospitals where you can get your medical tests done. So as I said, in Hyderabad it was CMM. So you will just have to like call them up and get an appointment. So for PR, right now they'll give you an appointment after 1 week, so it's like 1 week time for PRs as of now. So after a week you'll get your appointment, and the most important document for your medical tests is of course your passport. So without your passport you just cannot get this thing done. So they'll send you an email with the appointment details and all the documents which you need to like take to the center, and the most important one is of course your passport. And after your passport you'll need the HAP ID letter which I just spoke about earlier. That letter, your passport, and the third most important thing is of course your vaccination certificate, COVID. All right, so without the dual vaccination certificate, then I don't think they'll process your application, because I was asked the certificate at every step, and they were like checking whether we have the certificate and whether we are like dual vaccinated, because that's like the priority as of now. And if you do not have it, then I think they will they will ask you to like get vaccinated and then come back again. So I saw that a person who was sitting beside me, he was claiming that he was dual vaccinated, but his certificate was like only showing that he has taken only one vaccine. So he was asked to email that the second certificate again when he goes back home, and his application will be like pending till that time. So I don't know what happened afterwards, but that's the story. So in short, you should have like you should take both the vaccines, and you should have the certificate. So you can just directly get the certificate from CoWIN website, so that's easy. But the thing is, you should be like dual vaccinated. So once you have all these things, you can just directly walk in on the date and time specified, and then you will be like checked, the documents will be checked, and you can enter the facility, and then you'll be sitting for your turn. And in for Hyderabad CMM, the cell phone signal in that area is not really great, so it's better if you take cash. And for adults it's 6,000, and for children it's 4,000. But for children it's like there are like two things for children. So if you want, you can opt for the 4,000 thing or go for the 8,000 thing. So for 4,000 rupees, I think they'll apply some sort of patch on their skin, and for the results to turn up, it will take I think 48 hours or something. So that's the reason you will have to like go back after 48 hours. And if you do not want all these things, you can pay 8,000 per child, and these results can be done through the blood sample which is taken, I believe. So that's why I went for the 8,000 thing, and you don't have to like go back again. So you just sit there, wait for your turn, and then the first section is where they check your documents, and the second section is where they just get the payment done, and then they just ask you a couple of questions, some whether you had any operations done or something like that. And then the third section is where they take your blood sample, and for children also they take a blood sample. So that's like really painful for children, but you have to get that done. And also they take the urine sample, and after that they'll check your eyesight. So for eyesight, if you have spectacles, then you can wear your specs, and then just read the ABCD 1 2 3 4 5 characters, and that's it. It's not like if you have specs then you lose some points or some. It's not like that. You just need to take your specs and then read whatever they show you, and that's it. So they also check your weight and height. And after that is the X-ray part. So for X-ray, it's basically for TB. So if you have TB, then it'll like show up in your X-ray. So that's the thing. After your chest X-ray is done, you'll have to go to the third floor, I believe. You'll have to go to the second or third floor, and there you'll have to wait for a few minutes. And then when your turn comes up, then doctor examines you. So you'll have to get undressed till your underwear. Yeah. So wear a clean underwear and go. It shouldn't be like holes and stuff. So I'm just making a joke here. So anyways, so they'll undress you and then check pretty nicely. They'll check everything. It's not like they'll check you for like 15-20 minutes, because the doctor is like very experienced. He'll just do the examination in like 30 seconds, but he'll be like thorough. He'll go through everything. If there are like any marks on your body or your face or your hands or anywhere, then he'll ask you what those marks are. If you had an accident or any sort of operation or anything, then you should declare that saying that yeah, I had this thing done or whatever, because they will check everything, and they will like ask you all the questions. So if you have any previous reports regarding to any scars or any operations or anything, then you should take those reports just to be like sure, so that you can answer everything. And of course they'll ask you various questions regarding any illnesses or any TB attacks or any heart diseases or everything basically. Also they are particular about jaundice and HIV. So yeah, so you should be able to answer all the things regarding that. So basically they'll just ask you if you had any of these diseases in the past, or did you meet anyone who had these diseases. So yeah, you should be clear about that. If you did not meet or you did not have any of these, just answer no to everything, and that will be fine. So after this, basically your thing is done. You can just directly leave the facility, and you'll be told that this thing will get updated in your application, the main application, after a week. So right now for me, it hasn't been a week yet. It's like 3 days, I believe, 3 or 4 days. So I'm just waiting, and once it's updated, maybe I'll just show you a screenshot how it is right now. So this is how it looks right now. You can look at the screenshot, but in the future I believe this will get changed. And regarding the PCC, I'm still waiting for my PCC. It's not yet dispatched, so I don't know how many more days it will take. So I'm just waiting patiently. There are only like 3 documents, and all those 3 documents are like very important. So just to give you a recap, it's like your HAP ID PDF, a printout of that, 2 copies of your passport, front page and last page, yeah, along with your original passport of course, and the COVID certificate, fully vaccinated. So these three things are the only things which are required and nothing else. Of course, money is also required. So anyways, I think you get the idea what will happen with the medical examination and stuff. So as usual, thank you very much for watching, and I'll see you guys in the next one.